Now, it's important whenever we talk about this uh, fetal development, the environmental risks. Now, we have all been pretty well informed, hopefully, if we're at the college level, of the concept that, hey, there are a lot of environmental factors that can influence the development of the embryo or fetus. These are what's known as teratogens. So any environmental agent that can cause harm to the fetus. This can include things such as maternal diseases, obviously drugs and alcohol, and even stress, as well as environmental and occupational exposures. So whenever a fetus is exposed to high consumption of alcohol, this can lead to the fruition of fetal alcohol syndrome, which can lead to a lot of behavioral, neurocognitive, as well as physical difficulties. So whenever it comes to the physical difficulties of fetal alcohol syndrome or fetal alcohol spectrum disorders, this can lead to like a smooth philtrum, which is like we've all got this divot on our upper lip, but that becomes smooth with fetal alcohol syndrome, as well as a thin upper lip, a flatter mid-face, and things like that. Now, when it comes to the cognitive difficulties, this can lead to the fruition of ADHD. So there are symptoms of ADHD and of course with the frontal lobe difficulties through attention deficit as well as hyperactivity symptoms. So individuals with fetal alcohol syndrome have a higher likelihood of developing ADHD. Now, nicotine levels travel through the placenta to the fetus and has been associated with low birth rate, placenta previa, birth defects, preterm delivery, fetal growth restriction, and sudden infant death syndrome, or SIDS, which is, of course, death within the first 12 months or so from birth. And so this can lead to, or this is due to a number of things naturally. So if somebody, or if an infant unfortunately passes away due to SIDS, it can be due to, it's mainly because of the stoppage of breathing, and the stoppage of breathing can be through a number of ways: hyperthermia, overheating, unfortunately, the mouth being covered up as a result of being asleep on their stomach or sleeping with the parent, things like that. Now, some other environmental risks, obviously, even drugs that are prescribed to you, even if prescription medication is required, the lowest possible dose should be used, because even though you need it as a prescription, it can still cause harm to the developing embryo or fetus. That's not even talking about illicit drugs, which should be super obvious, not taking opioids or other forms of drugs that should be avoided, just even with not being pregnant, but will still unfortunately happen from time to time, where unfortunately infants will be born and they will be automatically addicted to a particular substance. That's one of the outlets. Of course, it can be physiologically experienced through like low birth weight. Like I said, they'll experience those withdrawal symptoms, birth defects, and then learning and behavioral problems down the road. So even your place of employment, or if you live in an environment where there's environmental chemicals, this can be through pollution, organic mercury compounds, herbicides, and industrial solvents. Sexually transmitted infections obviously goes without saying, but this can complicate pregnancy and may have serious effects on not just the baby, but the mother as well. Maternal diseases, maternal illness increases the chance that a baby will be born with a birth defect or have a chronic health problem. And then even something such as stress, being stressed out because of the link in blood supply between the mother and fetus. Stress can leave a lasting effect on the developing fetus. So if you are currently pregnant or know somebody who's pregnant watching this, whoever their partner is, make sure that they're limiting the amount of stress on the mother. So make sure to always go and support them with the cravings and with whatever they want. Okay, that was just kind of a side joke, but seriously, whenever it comes to stress, this can really impact that developing fetus. So when it comes to maternal mortality, about 830 women unfortunately die from preventable pregnancy or childbirth-related complications around the world, not just each year, not just each month, but every day. And almost all maternal deaths, 99%, occur in developing countries. The lifetime risk of maternal death in high-income countries is 1 in 3,300, compared to 1 in 41 in low-income countries. That is an astounding statistic, a very heart-wrenching statistic, but just to me is mind-blowing. So a pregnancy-related death, to define it, is the death of a woman while pregnant or within 1 year of the end of a pregnancy, regardless of the outcome, duration, or site of the pregnancy, from any cause related to or aggravated by the pregnancy or its management. So some top causes of pregnancy-related deaths include cardiovascular disease, non-cardiovascular disease, and infection or sepsis. Now, with spontaneous abortion, miscarriage is experienced in approximately 20 to 40% of undiagnosed pregnancies and in 10% of diagnosed pregnancies, and typically occurs before the 12th week.